This has been real hectic around here the last couple of days. I hope it slows down. We've made some mistakes this week.
What do you mean?
I had a voice message last night from one of our patients, Howard Beale. Did you know that we never called him back with the results of his INR yesterday?
I hope the results came back normal.
Here, take a look.
Yeah, that's within the normal range of 2 to 3 seconds. I'll make sure I call him this afternoon and tell him to stay on the same dose.
We had another near miss like this a couple of weeks ago. I hate to admit it, but looking at our data, Howard's not the only one who hasn't received results back. We're having some real communication challenges in our office. I think we need to implement TeamSTEPPS here.
Remind me about TeamSTEPPS again?
It's a great program with lots of different tools to improve communication and teamwork. We'll need someone to lead the effort. And I think Valerie is the perfect person. And she's a great communicator and works well with the other staff.
And she went to that workshop on quality improvement.
Yeah, she went to a workshop put on by Jackie Hardy. She's a practice facilitator who helps teams in the office setting. Valerie said that the workshop provided some information about TeamSTEPPS.
I think she followed up with more training on TeamSTEPPS too. I think she'd enjoy teaching the staff about all the new things she's learning.
Then let's do it. Valerie.
Hey.
Thanks for offering to be our improvement leader.
Oh, I really wanted to find a way to improve the care of our patients on anticoagulants. It's been a great opportunity to learn from a practice facilitator and develop this plan to implement TeamSTEPPS.
Let's get started on it.
First, I need to make sure that you agree with the timelines for achieving our goals. I created this process outline for our patients on anticoagulants to see where there are opportunities for improvement. Working together, the team will design and test processes that they think will work better. In the meantime, we can use TeamSTEPPS tools to improve our communication and then apply it to the care of our patients.
That sounds great. Let's take a look.
We're going to have to make some changes to the way we've done things in the past. With the whole team working together, I believe we'll improve patient satisfaction and safety. This will help us do a better job of getting lab results to our patients too.
Going forward, we'll make it a point to call our patients with their results. Some of them will need us to contact their provider to validate changes in the doses of their medicines.
I agree. My role in this, as I see it, is to teach our team members about communication tools and help develop processes that work. The first step is to take this plan to Dr. Simmons and Cindy and make sure we're all in agreement. I pulled these articles that describe evidence-based practices, but we'll definitely need Dr. Simmons' buy-in.
I agree, Valerie. As a matter of fact, maybe we can start with Dr. Simmons and do a rapid cycle improvement project. We could then help him do a couple of plan, do, study, act cycles and see what happens, and then spread our practice change across our entire office.
Exactly, that's how it works. I want to give this to Dr. Simmons tomorrow, and by next week, we can do our first cycle.
Sounds good. I think it's reasonable that we set a timeline of 2 weeks for Dr. Simmons to do this.
Okay.
That gives us enough patience so that we can pilot test the new process, study it, and make any changes we need before repeating the cycle. But how are we going to know if this is working?
Well, that's why we need these measures of success. I've listed a few of them here. I want to get Dr. Simmons' input in case he wants to add anything.
I like that. Once we work with Dr. Simmons, I want to make sure that everyone is comfortable in sharing their feedback, so we can tweak some of these things further if needed.
Absolutely. We need everyone's buy-in so we can truly own this process. I mean, that's an important success factor in making it all work.
Thanks, everyone, for taking time to meet, review our progress, and celebrate with us this morning. Valerie has been working really hard to help us improve our communication and provide better care for our patients. I want her to share with you all the improvements that we've worked on as a team.
I want to start by thanking all of you. This kind of success doesn't happen unless we're all contributing to it. We've made some changes to our process, and I want to show what we've achieved. I think the results speak for themselves. Over the past 3 months, we've increased the number of callbacks to our patients on the same day as their lab to 98%.
Wow.
I like it to be 100%, but 98% is still a lot better than 72%, which is where we started. You can see from the run chart that we've sustained our performance or met our target goal for the past 3 months.
That's a really good process measure, but to me the most telling metric is the clinical outcome of our patients. We've reduced the number of INRs out of a normal range by 50%. Our teamwork made that great improvement.
Well, it's clear to me that this work has helped us as a team as well as our patients. Using TeamSTEPPS, we now start with a brief in the morning and then develop a common plan to help me to anticipate the team's needs through the day. The task assistance tool has actually been very important for us, especially on days when we're really busy.
I agree, Hank. Mutual support is one of the most powerful things that I've ever encountered.
It's really great to hear you all talk about how TeamSTEPPS tools have helped. We have met every one of our goals for the past month, and I think we have a lot of reasons to celebrate.